Welcome to Artist in the OR, the continuing podcast series here at Spiro Plastic Surgery. This is episode 12. We're going to be talking about internal bra support. What does it mean? What is it used for? So we've got Gina, our RN nurse here at Spiro Plastic Surgery. She's going to be our moderator. Welcome.
Thanks. Episode 12. Crazy. We're already there. Okay, so internal bra. I think we touched on it a little bit in one of our other podcasts, but this is it needed its own podcast on its own.
Yeah, for sure.
So what does internal bra mean? Let's start there.
Well, internal bra is like the sexy term out there. Social media's got it. But
Yeah.
really what it is think of it as anything you can do to support the breast in whichever procedure you're using it in. So it means, and we're going to get through it,
Yeah.
a lot of different things.
Yeah.
But just think of it overarching as what are you doing to support the breast?
Yeah. So what surgeries, there's a bunch, which I think we should go through one by one, but what surgeries do you use internal bra support in?
Okay, so again, starting with think of a bra, it's on the outside. What am I doing on the inside that simulates what a bra does on the outside?
Right.
So we use it for primary implant augmentation of the breast. We use it for my technique of non-implant auto-augmentation, which is breast lift. We use it for revision implant surgery, of which there's a lot of, and we use it for primary and revision breast reconstruction.
Yeah, so 4 major types of surgeries.
Yes.
So what are the different ways that you use it in each one? I think we should break it down. So first one,
Yeah, 'cause
primary.
they're all different.
All different.
Yeah.
First one, primary implant breast
So
aug.
primary implant breast augmentation.
Yeah.
So big paradigm shift has been in using, when you have implant surgery, using internal bra to help support the implant. Because what happens over time in implants is in just the process of daily life, week after week, month after month, year after year, implants tend to move. And sometimes to the detriment of the outcome. So when we talk about internal bra and primary augmentation, we're talking about using, and I've got my own way of coming up with different techniques.
Yeah.
I use a material called P4HB. Other people know of it as Galaflex. I've created a way that I create 2 internal bra straps to drape around the implant to keep it from drifting either laterally or downward. So that's implant augmentation and my take of the internal bra with that, which has been amazing for that.
Very informative. So everyone comes in and they're like, I want his auto aug. And I'm like, how do you know about that? So auto aug, your auto augmentation, which is, like you said, non-implant breast lift. So how do you use it in that procedure?
Yeah, so in fact, this week we had 2 patients flew in from Florida for that surgery.
Yeah.
So non-implant auto-augmentation breast lift or non-implant auto-augmentation mastopexy or simply breast lift.
Yeah.
My take on this is I use 2 ways of doing it. Now, an internal bra doesn't mean you're necessarily adding something else. I use a way of making flaps out of breast tissue, dermoglandular flaps we call it, and I rearrange it, so tissue rearrangement, and I suture it in a different shape internally to maybe simulate an implant. And when I suture it together, that acts as an internal bra. I also sometimes will enhance that with another piece of material known as P4HB, which is a synthetic, and it's sort of like a synthetic biologic, and that's kind of how you could break this up. So there's synthetics and biologics. So I use it to drape over the breast when I'm doing that, and again, and then I drape the skin tissues over that. So that's an embellishment. Different way of doing it around an implant than it is around just native breast tissue that I'm just lifting.
Yeah. We had a patient the other day come in and she asked me a question like, are my breasts going to feel softer or whatever? And I was like, oh, well, you have an implant in. Like, it's always going to feel like you have something there. And she's like, I don't have an implant. And that was one of the procedures. You did the non-implant lift with the internal bra. And I was like, oh my gosh.
Sometimes when
you can't tell sometimes.
Yeah, sometimes we'll see patients long-term post-op.
Yeah.
And if I don't look at the chart right away before we go into the room, and I look at the patient, even I will think for a second, oh, this is an implant case. Or I'll tell the residents, I'll say, you know, I could take this outcome and I could go to my next meeting that I'm presenting at and even trick my colleagues in the audience from my non-implant breast lift and put it in the implant section, and people will think it was an implant.
They wouldn't know.
It's crazy.
I was like, oh, you're right. You don't have an implant.
Yeah, exactly.
But okay, so another surgery which we see a lot, which people come kind of everywhere, revision implant surgery. We see it, I mean, you do it weekly. So what's the way that you use the internal bra in that procedure?
So that's another area where it's needed. And I'm using internal bra or concept of internal bra all the time. So in these revision implant cases, and we're talking about sort of cosmetic implant revision surgery, it's more complicated. So we talked a little bit P4HB, Galaflex, synthetics or hybrid synthetic biologics. Now we're getting into the realm of the biologics. And the biologics are my favorite being Stratus, which is pig tissue. And people are like, oh, pig tissue? And I'm like, yeah, think about it. Heart valve, pig tissue. It's very well accepted in the human body. No rejection phenomenon. And to me, in my hands, it's the most versatile for the complex issues of revision implant surgery. So cosmetic implant augmentation that we went over, that's synthetics. I divide it and use 2 straps around the implant, holds it in place. When they lay back, it doesn't lateralize. When they stand up, it doesn't go downward. In my auto-augmentation non-implant surgery, again, the Galaflex P4HB to support my dermoglandular flap construct, which is of itself an internal bra. But now when we get patients, and you know this, patients who are coming in, again, from all over the country, locally, the area, with complex issues related to breast implant surgery gone awry elsewhere. And some of those patients have had 1, 2, 3, 5, I think the world record holder was 9 previous surgeries before they came in here, and I fixed her in 1 surgery. I'm relying on the scaffold of a biologic like the pig tissue graft, the Stratus. And what I'm doing is I'm creating an internal bra hybrid of that Stratus. For everybody out there, think about, you know what the shape of your bra looks like. Well, I'm creating that shape of the bra inside with that pig tissue. So think about, you're wearing a bra on the inside of pig tissue, sometimes joined to the pectoralis muscle. So it's really involved, highly technical, oftentimes requires a breast lift over that. But, you know, you've seen it. The results are unbelievable. And no offense to you primary breast augmentation patients out there, but these patients have spectacular results in these secondary cases. And, you know, these patients are coming in here despondent. They've had a couple of breast surgeries. It's not what they want to look like. And we can get them fixed in this operation. So.
Okay, last one, revision and primary reconstruction.
So
that's a big one.
Now that's the fourth sort of incantation of how we're doing this. So again, I'm relying on biologics, but this time I'm using human tissue graft. And people sometimes are like, oh my God, human tissue graft? Well, it's ubiquitous. We're using this in breast cancer reconstruction patients, post-mastectomy reconstruction patients. And similarly, I'm creating this construct inside, only it doesn't look like a bra that you wear, I've created this process of 360-degree spherical total wrap of human tissue around implants. Because one of the negatives that patients hear about who have implant breast reconstruction after mastectomy is, oh, it looks like a ball, or oh,
Yeah.
I see rippling, or I want a more natural look. Well, I figured out a way years ago to take these human tissue grafts and totally wrap the implant around them and put that inside and stitch it in place, and it just looks and feels more like a cosmetic implant augmentation than a cancer reconstruction.
Right. Yeah.
So,
And great, we see great results with those. Yeah.
yeah. So they're all distinct. They're all different.
Yeah, all different.
Yeah.
So you mentioned all the different options and the 4 major procedures. So how do you kind of determine which patient receives what support?
Good question.
Yeah.
So there's subtle incantations of each. We went over the 4 basic principles.
Yeah.
And, I like what I like, and I'm good with what I use. But sometimes everybody's different. So the amount and where I place it depends on the problem that presents itself,
Right.
particularly in the revision implant patient, but also, the primary augmentation patient.
Mm-hmm.
No 2 women present the same. And most patients come in here not realizing that when I look at them, I'm looking at the base. I'm looking at the rib cage, because their breast sits on their rib cage. And the instant I'm looking at them, I'm already thinking, strategizing, how am I going to get a max outcome with these patients from what they want to have achieved using these internal graft supports, these internal bras.
Yeah.
So it's hard to say, because I probably do it subtly differently in everybody to maximize any individual outcome.
Yeah. Okay, so why would a patient need support in the first place? Because, sometimes you say you could do plain breast aug or plain breast lift, and then you give the option if they're a candidate.
Right,
So they come in, they question it, and you give a thorough explanation. So
one word.
Yeah.
It's called gravity.
Yeah.
It's gravity. Gravity affects everybody 100%
Never
of the time.
loses.
Never loses.
Yeah.
Gina knows my line. I say it to patients all the time. Gravity's undefeated, has never lost.
Yeah.
It's going to beat everybody.
Yeah.
And you got to do whatever you can do to sort of fight it off. We also joke, you hear me joke with patients all the time. I say, on the moon, women don't need internal bras.
Yeah, you wouldn't have a job.
There are no plastic surgeons there, right? If we live underwater, you don't need an internal bra support. But the facts are gravity's unrelenting. And these are sophisticated procedures that nobody really thought of in breast augmentation in the 90s, in the early 2000s, until, women aged. Implants were now, 20, 30, 40 years into the implant history of implants, and patients were having issues. They were coming in, implants were lateralizing when they lay down. They were dropping over time, saline or silicone gel. So that's kind of how all this stuff came about.
Yeah. So, you kind of said it, but how does it affect long-term outcomes? You said lateralization, gravity, it's kind of all that.
Yeah,
main
for
factors.
sure. Well, like I'll get patients come in, they may have implants already, or we talk about chest wall and we make them lay flat.
Yeah.
And I stand at their feet and I evaluate their rib cage. And you've seen this from patients who've had implants before elsewhere. They come in and lay down and, implants go in the armpit.
Yeah.
So it's all gravity-induced traction stuff. So that's kind of what we're strategizing to fix with these patients.
Yeah.
And the amazing thing is now, after we're using these internal bras in augments or secondary cases, those patients come back 3-6 months later, we ask them to lie back and their breasts don't lateralize.
Yeah.
It's amazing.
It's amazing.
It's just amazing how this really has created such a paradigm shift.
Yeah. And I think that one thing that we're good at is educating all the time, which you educate a lot about
I
that.
do, but you guys hammer
Yeah.
at home.
Yeah, I think
Yeah.
one thing we educate a lot about, especially, is recovery.
Yeah.
So how does this differ with an internal bra, their recovery,
Yeah.
than if they didn't have one? Does it differ?
Well, so here's the interesting thing. Now that we're doing a lot of subfascial over the muscle augmentation, there's like no recovery. Patients are like
Yeah,
the next day in the office smiling, chatting,
yeah,
like they never had an
yeah.
operation.
Like,
And we're like, whoa, whoa, whoa,
you
whoa.
did just have
You
surgery.
did have
Yeah,
surgery.
I was
You
there.
got to dial it down,
Yeah,
right?
right.
And I know you look great and you
Yeah.
feel great and you're barely swollen and you're not bruised and you have no pain.
Yeah,
But augmentation and all the other surgeries we talked about, simple breast lift, not so simple anymore.
Yeah.
They actually are more complicated than they were 5 or 10 or 20 years ago. So patients have to respect recovery.
yeah,
It's longer, and it's hard for them to understand that we say, you got to buy in. It's a month of please be low key. We're going to be out of your hair in a month.
yeah,
You go do whatever you want. But yeah, you can drive in a couple of days. Okay, you can go do things. But every time you move around, go like this, we don't want things getting dislodged.
yeah,
Just let everything heal. Plastic surgery would be really easy if we didn't have to do symmetry. If there was
Yeah.
one breast, one eye,
yeah, yeah,
then we wouldn't care. But because trying to get things to heal the same that
Same.
don't know each other
right.
requires people be low key. So the recovery is all about laying low. I know you want to get back to the gym, but you just got to lay low,
Yeah.
let things heal, and then
See ya. Yeah. So how does something like tissue quality dictate the need for support, or if they
Yeah.
could, if they're a
good-
candidate?
Yeah. So, it's all about kind of tissue interaction. If the skin and the breast tissue is held together, then it may be less of a need for internal bra support. If somebody's aging poorly and the skin is super loose, paper thin, really wrinkled, breast gland falls to the bottom like, coal in a Christmas stocking type idea,
Yeah.
then then it's a different interaction and,
Yeah.
and requirements may be more significant, which is important because I know I may not be in the room and Gina hears from a patient, why is he telling me I need an internal bra like this when my 2 girlfriends
Yes.
went to him and they didn't need it?
Yes.
So
We get
that's
that all the
yeah,
time.
we get that all the time.
Yeah.
So yeah.
Okay, so how do you use it as, again, you kind of touched upon it, but as like a preventative strategy?
Yeah, so it's back to gravity. Gravity's unrelenting. It's never going to end. So, now I'm looking at, here's the simplest way to say it. I think 8 or 10 years ago when we were just starting to think about these internal bra supports, they really didn't exist before that.
Yeah.
I used to say to myself when I looked at a patient, what is it about this patient that makes me want to use it? What convinces me to want to do it? Now, and I've got residents that I'm teaching all the latest cosmetic techniques to, by them watching me and joining me in the OR. Now I tell them, now I look at a patient and I say, when I look at the patient, what is it about this patient that makes me not want to use it, which is essentially almost never now.
Yeah.
And I'm using internal bra support in all of those things virtually all the time now. So major, major shift. But going forward, the implants are probably going to last longer. The breasts are going to be nicer for a much longer period of time.
Yeah. So I think one of the questions that people have too is or misconception is what can it do and what can't it do?
Right. So, it's an interesting thing. Now in the age of AI, when we have patients, we tell them bring in like images, their wish list, what they want to look like. That's kind of how we determine. That's our own AI way of sort of figuring out what they want and how to achieve it. But a lot of patients are coming in showing images that are not even people. They're
Yeah.
anime. They're AI designed, non-human, beautiful breasts on women. And okay, you want to achieve that. Sometimes I have to sit down with somebody and say, you just showed me, a 20-year-old woman's breast, and this isn't you starting.
Yeah.
So let's talk about how we can closely get there. So it's part of our consult and discuss process. But I love the idea of how we tell patients, go out and get images,
Yeah.
bring them in so we can discuss it. Because here at Spiro Plastic Surgery, we want everything out in the open. I want patients to be fully on board. I'm a good teacher. I'm going to technically get them where we can get them, which is often the images they show. But then we also use it for what may or may not be achievable.
Yeah.
Usually we can achieve the next to impossible,
Yeah.
but it's part of the give and take and the
Yes.
learning and their education of the patient.
Yeah.
So.
And I think that another thing we have to kind of debunk, especially with social media, which I want you to touch upon, is common misconceptions about internal support. Because
Right.
people come in thinking what
They
they
say,
find online.
well, you know this. Somebody is going to come in and say, I want my breasts up here. I want them super round. I don't want them ever to sag, ever to sag. So, internal bra is not a panacea. It's an aid. It's a tool. It's an assistance. It's something that's going to elevate their outcome for sure. Longevity, everything. But there's no perfect anything out there. And people have to know that just because we're doing internal bra support, in any one of the numerous ways we do breast surgery, there's no outcome that's going to stay forever and ever and ever.
Yeah. So. I like what you say to patients after surgery, like you're started aging right when surgery was over.
Yeah, so they say, well, is it going to stay like this forever?
Yeah.
How is it going to age? I said, well, from the time you came in the room, we started this conversation, your breast is aging.
Yes.
So,
yeah.
Well,
this was super informative. I think that hopefully everyone could listen to it and get all this information in and, talk to us when they come back and they could teach us some stuff. But
yeah, I'm so glad that we had an opportunity to sit and talk about internal bra, what it means, the various options. We could do 20 podcasts on all the different parts of internal bra and all the different surgeries.
Yeah.
But thanks again for listening to us and watching us on episode 12 of Artist in the OR here at Spiro Plastic Surgery. I'm Dr. Scott Spiro, and again, as always, our great moderator, Gina. Thanks, everybody.
Thanks, guys.
Yeah.